Today I'm going to speak about how to brush someone else's teeth and care for their mouth. I am Casey Smith-Saxton. Why do folks in residential care need assistance brushing their teeth? Items to consider: lack of mobility, lack of grip strength. That's important to think about when it comes to gripping a toothbrush. They're very thin, and it's hard for an arthritic hand to grab a thin manual toothbrush. Sonicare Oral-B spin brushes are a little bit fatter handle, and I feel like that can help encourage them to brush their own teeth at their own pace. They're also perhaps unable to purchase or obtain supplies that they need, and not just need things they like, the mouthwash they like, the toothpaste they like, that can keep them from wanting to even get their teeth brushed. And then just simply being unmotivated, which is every single person. Anyone can be unmotivated to care for their mouth. A mouth filled with bacteria and rotting food can cause aspiration pneumonia, tooth decay, which is tricky because a lot of times these folks are not able to get to their dentist as quickly as they could if they could take themselves. It's also tricky sometimes to coordinate that visit, and for sure these folks aren't leaving every 6 months to get their teeth cleaned by a dental hygienist. Bad breath, which can be very embarrassing. Gingivitis, which can cause bleeding, swollen gums. Periodontal disease. A sore or painful mouth, which doesn't encourage people to eat. And then just the sheer embarrassment of having a gross mouth. Should you decide to attack the daunting task of brushing someone else's teeth, here are the supplies that you need. Disposable gloves. You'll need a new pair each time for each patient. A toothbrush with soft bristles and a small head, and this can be a manual toothbrush if you're prepared to use it yourself. Fluoride toothpaste, a pea-sized amount smeared onto the brush. If the person doesn't like toothpaste or has difficulty swallowing, brush with water only. The toothpaste is there to give you a fresh breath feeling, so you can totally substitute a mouthwash or a mouth rinse if that feels better to the resident. So sorry. You also are going to need a basin or bowl, a towel to protect the person's clothing and wipe the mouth. And here they've suggested a good light. A camping head torch can be useful. I think that's important when you are at home with your loved one. I don't believe that CNAs and CMAs have access to that. Maybe a pen light is available. It does take some coordination to manage that, or two of you, perhaps. I think that creativity is important when it comes to this type of thing. Making sure that people are comfortable, that you've gained the permission from the person whose teeth you're about to brush, and just in general, where are you both at when it comes to this task? Here are the steps for brushing another human's teeth. Step 1, encourage the person to relax their lips and cheeks. Introduce the toothbrush at the corner of the mouth. You don't want to try to just poke it in the front of the mouth. You want to place the toothbrush on the gum line. Once you have achieved access to the oral cavity, you want to place it at the gum line. And then brush 1 or 2 teeth at a time, focusing on the gum line at a 45-degree angle, using a jiggle, jiggle, sweep, jiggle, jiggle, sweep, jiggle, jiggle, sweep motion. You always want to sweep in the direction of the tongue. So you'll jiggle, jiggle, sweep down when you're on the upper teeth, and then jiggle, jiggle, sweep up when it comes to the lower teeth. Consider a second toothbrush to lift the lip and cheeks to see the gums better. I think that's a great suggestion. And that would be on the other side, or that's just to kind of pull the lip out so you can see what's going on in there. Brush all surfaces of the teeth. You want to do the surfaces next to the tongue, the surfaces next to the cheek, and tops of the teeth. Also, gently brush the insides of the cheek, the gums, and under the tongue. Now that is with a very, very soft toothbrush. You never want to be rough or put too much pressure, just gentle sweeping motions. Anything that can be done to remove some of that bacteria is the move. And then help the person spit out any toothpaste left in the mouth. At this time, you can also offer a mouth rinse if that's what the patient likes. client, resident, I'll use these terms interchangeably. It's really up to the person whose teeth you're brushing. How often should a mouth be brushed or cleaned? Ideally after every meal or snack, even if it's just a quick swish and spit with water. What that does is just lower the bacteria load, drop the acid load, so bacteria doesn't want to hang in there and stick to the teeth. Realistically, every night at bedtime it should occur. The food that has been in the mouth all day from start to finish, get that cleaned up so overnight there isn't a breeding ground for decay, bacteria, that type of thing. Things to consider before you brush. Does this resident have an altered mental status? I think that's important to think about because, a toothbrush isn't a toothbrush if you're dealing with an Alzheimer's person. Not always can it be. And I think that's important to consider. What day do these folks best function? What time of day? Is it in the morning? Is it at night? And maybe work in this toothbrushing routine at the perfect time. Is it after a meal? Is it before a meal? I think that is key, knowing your audience. Have you gained consent from the resident? No one wants to be snuck up on. People have a lot of phobias around their mouth, their teeth. A lot of old dentists were not kind. They don't know what we know now. So it's important to always gain consent. Also to consider, how much can the resident assist you with this process? Can they help? Can they hold their own lips out? Can they brush while you hold their lips out? What can happen so this is a team effort, not just you're brushing someone else's teeth? Think about how this experience can be enjoyable for both of you. Can you make small talk? Can you make it clear that this is not your idea of a great time either, but it's a thing that has to be done, and the sooner that you both kind of attack it together, the better it will be. What is your approach going to be about this? Does the resident have anything removable in their mouth? This is a partial, this is a denture of any kind. All of that needs to come out before the brushing begins. Rinse that off. I will go into a little bit deeper talk about how to care for those things in just a second. Then to consider, is the resident currently experiencing a painful or sore mouth? If for some reason you're back there brushing and they wince or kind of blink their eyes, what's going on back there? Ask them questions to know more. And then if you have the opportunity, get in there and really see what is going on. A lot of times oral cancer's missed. Maybe they've bit their cheek and didn't know it, and now there's this huge wound in their mouth, or they're just sensitive because they have dry mouth already. Because when you are not in your home and you're not able to check it out for yourself, people that help take care of you, they're the number one person who can go in and say, that wasn't there 3 days ago. Maybe I better tell somebody about that. That's the type of thing that can also, benefit everyone when you're doing this toothbrushing. How do you care for a denture or partial denture? To be clear, a denture has all the teeth on it. It's 2 pieces usually, 1 piece on top, 1 piece on bottom, if they have no teeth at all. If there's some teeth, there'll be what we call a partial, and that will replace a few of the teeth. So it's not every tooth is gone. You take that out, there's still some natural teeth in their mouth. And once you've removed that, rinsed it off, put it in a tooth cup or a denture cup, then you'll be able to brush those natural teeth, rinse off the partial or denture, and pop it back in for them at the end of the treatment. Always only use a denture-specific brush on dentures and partials. Don't use the regular toothbrush they're using on their teeth if they have teeth. And if they don't have teeth, just stick with that denture brush. Don't use toothpaste on a denture as it will scratch the acrylic, which is not good. Offer this resident an option of a rinse with an alcohol-free mouthwash to feel fresh. A lot of times folks have their favorite. Offer that if it's available. Ask the resident, did you want to wipe your mouth out? Did you want to rinse your mouth out? If they're not able to comment, Gaze in there casually. Is there chunks of stuff? Can you wipe it with some gauze without causing any type of issue? Always work over a sink filled with water and wear gloves. That is included when you're using a denture. If you drop it, you want to drop it into that sink full of water and not onto the floor and break it. Do's and don'ts for the care of dentures. Do remember that dentures or partials are specific to each person and should not be shared. Do remember that dentures and partials are expensive to replace, repair. And again, how is this resident going to get to their normal dentist to get that handled? Do report any suspicious painful areas to the resident's mouth. Do not put household cleaners in the denture or tooth cup. I'm talking about Comet, bleach, none of that. Don't do it. Don't allow dentures or partials to sit on bedsides or tabletops without being in a denture cup. They really just need to go in the cup labeled with the resident's name in water or mouthwash, whatever feels right. Or the denture cleanser situation. Don't use toothpaste on the denture or partial ever. I think I wrote that 2 times. Don't do it. It will scratch it. What if the resident refuses to wear their denture? Keep the denture in a specific tooth case or tooth cup. Rinse out the tooth cup, fill it with cool water, throw the denture cleansing tab in if that's what the client prefers. If the cleansing tab is not preferred, throw that denture or partial in the cool water and shut the lid tight. Don't fight them. It's okay. They don't have to have it. Just keep track of it. Don't lose it. Keep it in the water. In conclusion, this is a topic that is near and dear to my heart because it is such an overlooked item when caring for someone. A clean mouth can help you feel great and have a great day, and these folks deserve that too. Here are my resources. Thank you so much for being a great audience today.